Hello, Alicia Willoughby. Thanks for
Hello.
joining us again today. We're going to be talking about Diastasis Recti, which I have called before in the past as a mistake distension. So
Right.
I really want to understand what the difference is and how one is not the other exactly.
Right.
And also, someone told me that this is your favorite muscle.
Well, one of the muscles, yes.
Which I just
I'll
find
explain.
intriguing. So tell us about that. Why is it
Okay.
your favorite muscle?
So my favorite muscle, a diastasis recti is the name for an abdominal separation.
Okay.
We have 4 abdominal muscles.
Mm-hmm.
The most superficial one is the six-pack muscle, which is what most people know about. And then we have 2 sets of obliques. Okay, we've all usually heard those. If you take off all 3 of those layers, you're left with dun, 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 the transversus abdominis. Okay, so this muscle runs horizontally, so its fibers go this way.
Okay.
And it attaches to the pubic bone all the way up to the ribs, and then it wraps around and it actually inserts into the fascia into our spine. Okay, where the six-pack muscle runs up and down and only has attachments at the top and the bottom. Okay, so this muscle is my favorite muscle.
Okay.
Its function is to hold our pelvis and our spine stable as we move an arm, a leg, or move our body through space. Okay. So in a healthy system, the way this should work with the pelvic floor is that the millisecond before I go to get up, my brain should turn on my pelvic floor to stabilize my pelvis, my transversus abdominis to stabilize the rest of my spine, and then I should move with a stable spine and pelvis. Okay. So its function is essential to our bodies. It doesn't move us, which means that if you do a sit-up or a crunch or a bicycle type of exercise, this transversus muscle is not doing that activity. All it does is it stabilizes us or wraps around us like a corset. Okay. In pregnancy, its function is to hold your baby up. If a woman is not using their diastasis and that's not active in their system, then you'll see that their belly is hanging out more and they have that big arch in their lower back, which is usually the biggest cause of low back pain in pregnancy. That general low back pain, not the sharp stabbing pain on one side of the pelvis, but like the general low back pain, because they're letting all their abdominal muscles relax and letting the belly just fall forward.
Now, is this for both first-time moms and then also additional pregnancies?
Yes.
Okay.
In additional pregnancies, it can be more so because the transversus might not have ever reconnected with the brain from the first pregnancy.
Okay.
So, like I talked about in the pelvic floor, what happens with the transversus muscle because of pregnancy is it gets stretched out, and then there could be trauma directly to the muscle from a C-section, and the brain loses its control of this muscle, just like it does the pelvic floor.
Okay.
Which is why postpartum, a woman, their belly might still be hanging out because they literally can't get their brain to draw their belly back in. So its primary role postpartum should be to activate, to draw the belly back in, support neutral spine, support your posture, and work with the pelvic floor to keep everything happy in the spine.
Okay. So when I used to say distension, can you correct me so that we all understand what that is and that it's not exactly the same thing?
So distension is a sign that a woman may have an abdominal separation. Okay. So distension, I would also call it abdominal doming. So when the woman is lying down and lifts her head up, you would see like this big dome come up in the midline of her belly, and that is a sign that there may be an abdominal separation, which is in the fascia, the midline area of the abdominal tissue.
And is part of that normal during pregnancy and childbirth and early postpartum? Is it never? Okay, so you already answered that. It is.
Almost every woman will have one at the end of their 3rd trimester just to make room for growing baby, which is why I'll never look for one or measure one on a woman who's in her 3rd trimester, because it they're likely going to have one.
Right.
Yeah.
Okay, and so then when should we be seeing some change after giving
Right.
birth?
I like to see that by 6 to 8 weeks, that the separation is starting to resolve or close, and that there isn't any abdominal doming or distension when the woman moves their body, sits up, lifts a leg, that kind of thing. Now,
and does that happen on its own, like in just normal healing? Is that supposed to happen, or is there something that someone who just gave birth can do to get them on their way, or the opposite of that too? Like, what are we doing to get in our way?
Some of it will happen on its own. Some of it is just recoil of our tissues. They get stretched out, they recoil back together. Some of it is genetic on how much your tissue recoils back together. But if a woman doesn't have good connection, meaning their brain can't activate their transversus abdominis, then the likelihood of that muscle coming back together, that separation coming back together, is lower.
Okay.
Yeah. And so in order to get that separation to close, you have to regain your brain's connection with this transversus, because what the transversus is going to do is, as it draws the woman's belly back in, that separated tissue is going to come closer together.
Okay. And so what are you telling your patients that actually come in to see you that they could take a few steps to get back to where they want? What is the best suggestion for that? Or is it random depending on each person?
Well, it's exercise specific.
Okay.
I mean, there are I can tell you some big no-nos that are across the board.
Helpful.
So I'm very anti crunches and sit-ups for a postpartum woman. Really for a long time postpartum, until a woman can show me that they can do it without their abdominals doming, and most of them cannot. Or that they have transversus connection. So if a woman goes back to crunches or sit-ups, or any of the Pilates type of moves where both of they're lying on their back and both their legs are up in the air, that's another big one that you'll see that distension or doming. If a woman continues to do that, it will either make the separation worse, prevent it from closing, or they can strengthen